Hi there, my old and new friends. My name is Natalia. I'm a registered dental hygienist and I'm welcoming you to my YouTube channel, Happy Smiles. I'm very excited that you are here with me today, guys. So today we're going to talk about ketos teeth, the importance of taking care of baby teeth and how to do it right for different ages. So stay tuned with me, guys. Healthy teeth are an important part of your child's overall health. Helping your child to develop a good oral health begins at birth. So a primary or baby tooth usually comes around 6 months of age, but it is not unusual for those baby teeth comes as early as 3 months or as late as 12 months. Everybody is different, but usually your child will have all 20 primary or baby teeth by the age 3. About 5 and 6 years old, your baby will start to lose those baby teeth or primary teeth to make room for permanent or adult teeth. So why are primary teeth are so important? First of all, primary teeth will shape your child's face and they also will guide the permanent teeth into the right position. Primary teeth are crucial for development such as speaking and eating, so it's extremely important to take care of those guys. The biggest problem that we see with children's teeth is decay. Decay caused by bacteria that we have in our mouth, and those bacteria combined with anything sweet or sugary, like sugar drink, such as milk, juice, even breast milk has a sugar as well, and that will combine with our saliva and create bacteria that will cause destruction of child teeth enamel. Primary teeth usually they have very thin enamel compared to the permanent or adult teeth. As adult, our enamel, the white outer layer of our teeth, are very strong. Our enamel is stronger than our bones, believe it or not. Children, unfortunately, have a very thin enamel compared to us, so it's very crucial to take care and clean those teeth as early as those teeth start to come out. So my friends, how we take care of our children's teeth? Let's start with infancy. So as I mentioned earlier, when a first tooth appears around 6 months of age, but it's not uncommon as early as 3 or as late as 12. So it's very, very important to take care of your children's teeth before they even appears. So before your child have any teeth in their mouth, just take a warm cloth, like a cotton cloth, and you can just put it in your finger and rub your child's gums. Very important, usually in bedtime, but you can do it twice a day as well. Right around when your child's first tooth appears, it's extremely excited moment for all of us. You can use a specifically designed tooth brush for infants. It's a little tiny brush, or it's a silicone that you put in your finger with a little rubbery in the tip, and you can brush those first teeth or tooth with that brush, usually in the bedtime, but you can do it more often. Another tip is try to eliminate sweet drinks like sugary juices or milk throughout the day. If obviously at that age your child most likely will have a breast milk or bottle formula, just make sure that you are going to wipe their gums or brush the tooth or two right before they go to bed to eliminate all those bacteria in the mouth. Also, please do not put a pacifier or a bottle in your mouth before you give to your child. We're all guilty of this. I know I am. So when pacifier fell on the ground, you just don't have a running water to clean it. So what we do, put it in our mouth and then give it to our children. It's not really a great idea to do it, because you can transfer your bacteria from your mouth to your child. And caries, decay, it's a transmittable disease. So you can pass, if you have an active decay in your mouth, you can pass it to your child's mouth. So try not to do it. And another tip for that age is first visit to the dentist. It's a very big moment, very excited moment for all families. We usually recommend to see a dentist for the first time after your child's first tooth erupted within 6 months. So it could be, usually it's around 12 months when parents bring their babies to the dental office. It's a great way to get familiar with the dental setting. Usually dentists will just briefly look in a child's mouth, make sure that everything is healthy inside. And it also will develop a great habit for your child to not have any fears of dental office. Usually they will ask you to go to the dentist because after each dental visit, your child will be pampered with toys and just giggling all over it, and usually they give a toy in the end. So it's a great experience for kids and adults as well. Moving on next, 1 to 2 years old. So between 1 and 2, you will most likely take your child to his or her first dental visit. It's very important to start brushing your child's teeth once a day, or sometimes even twice if you can, but do not use toothpaste with fluoride. Not fluoridated toothpaste, specific design for that age, and use specific toothbrush, specifically designed for that category. Very important, once a month to check your child's teeth for decay or caries. Very simple, just lift your child's lips upper and low and look for anything abnormal that looks an enamel. Usually the decay will appear white checky or brown spots. And if you notice any, take your child to the dentist as soon as possible for diagnosis. Also very important to try to eliminate bottle, maybe switch bottle to the sippy cup, and also try to eliminate or take away a pacifier, especially in bedtime. All right, my friends, moving on next to the 3 to 4 years olds. So by this age, you should teach your child the rule 2 for 2. 2 minutes of brushing twice a day. By this age, you can introduce fluoridated toothpaste. Just make sure that you put a tiny little amount, like a pea size, and it has to be supervised by an adult. Teach your child how to spit rather than swallow. At this age, you can introduce an electric toothbrush as well. A lot of electric toothbrushes, you can Bluetooth it to your phone or to your tablet, and you can download an app specifically designed for children. It's an amazing tool. It looks like a toy, it looks like a cartoon, but your child can see on the tablet or a phone reflection of them, or it's usually some sort of character. And when your child is brushing their teeth, it will show on a screen how well he or she does this. And it gives you rewards. So kids, for them, it's just more like a game. So it's a great tool to look into. Sonicare does this really good job. I think it's called Sparkle. The guy, little character. I believe Oral-B does this as well. Also make sure that your child clean all the teeth surfaces, fronts, backs, chewing surfaces, and in between the teeth as well. You can start using little flossers at this age that's specifically designed for kids, and so they can clean all 5 surfaces of their teeth as well. And also, if your child is still sucking on a thumb or using a pacifier, please talk to the dentist. How can you easily break this bad habit? All right, 4 years old and up. By that age, your child should be brushing his or her teeth independently twice a day for 2 minutes. You can obviously supervise them, make sure that they do it correctly. By that age, your child should be flossing their teeth, and you can also introduce a water flosser such as Waterpik, specifically designed for children. It will give an extra benefit to keep your child's mouth healthy. They can also use a fluoride mouth rinse at the end to give this extra boost of fluoride to keep their thin enamel as healthy and caries-free as long as possible. Also, make sure that you and your child visit dentist annually for exams and for the routine professional dental cleanings twice a year. Also, this age is a very important talk about nutrition and to eliminate as much sugary drink and snacks as possible. Make sure that your child's diet consists of a lot of fruits and vegetables and pure water. If your child drinks a lot of juice or milk, just try to switch it to water as much as possible. And obviously try to avoid sugary snacks, sugary drinks. So it's going to develop a great habit for your child to be as healthy as possible, as early as possible. All right, my friends, I hope this video was beneficial for you and your little ones. Thank you so much for being here with me today. I'm very grateful to have you all. Please continue to subscribe to my YouTube channel, give me likes, and I will see you next time. Keep smiling, guys. Bye.